Question 1. Governance review demonstrates a need to enhance the systematic evaluation of factors impacting wound healing. A certified wound specialist, CWS, is presented with a patient exhibiting a non-healing lower extremity wound. The CWS is tasked with developing an initial plan of care. Which of the following approaches best reflects a comprehensive and compliant strategy for this CWS, considering both local and systemic factors as mandated by best practices and regulatory expectations for wound management? Option A. Conduct a thorough assessment of the wound bed, including evaluation for infection, adequate perfusion, presence of edema, pressure points, moisture balance, desiccation/maceration, and any signs of ongoing trauma, while simultaneously gathering information on the patient's age, nutritional status, relevant comorbidities, and current medication regimen. Option B. Prioritize immediate interventions for visible local issues such as wound cleansing and application of a moisture-retaining dressing, deferring detailed assessment of systemic factors until the wound shows initial signs of improvement. Option C. Rely on the patient's verbal report of pain and discomfort to guide the selection of topical treatments, without performing objective wound measurements or inquiring about their medical history and medications. Option D. Focus primarily on managing local wound factors like pressure reduction and preventing desiccation, assuming that addressing these will naturally lead to healing without extensive investigation into systemic influences or perfusion. Correct answer is A. Conduct a thorough assessment of the wound bed, including evaluation for infection, adequate perfusion, presence of edema, pressure points, moisture balance, desiccation/maceration, and any signs of ongoing trauma, while simultaneously gathering information on the patient's age, nutritional status, relevant comorbidities, and current medication regimen. Explanation. This scenario is professionally challenging because it requires the certified wound specialist, CWS, to synthesize complex information regarding both local and systemic factors affecting wound healing, and to apply this knowledge within the strict regulatory framework governing wound care practice. The CWS must not only identify potential barriers to healing, but also prioritize interventions based on their immediate impact and the patient's overall condition, all while adhering to established standards of care and ethical principles. Careful judgment is required to differentiate between factors that can be directly managed by the CWS and those requiring collaboration with other healthcare professionals. The correct approach involves a comprehensive assessment that systematically evaluates all identified local and systemic factors. This approach is correct because it aligns with the CWS scope of practice and ethical obligation to provide holistic patient care. By considering infection, perfusion, edema, pressure, desiccation, trauma, age, nutrition, comorbidities, and medications, the CWS ensures that no critical element is overlooked. This comprehensive evaluation allows for the development of a tailored, evidence-based treatment plan that addresses the root causes of delayed healing. Regulatory guidelines for wound care emphasize a patient-centered, multidisciplinary approach, which this comprehensive assessment facilitates. An approach that focuses solely on local factors, such as infection and desiccation, while neglecting systemic factors like nutrition and comorbidities, is incorrect. This failure represents a significant ethical lapse and a potential violation of regulatory standards that mandate a holistic view of the patient. Ignoring systemic issues can lead to ineffective treatment, prolonged healing times, and increased risk of complications, as the underlying systemic problems continue to impede the healing process. This approach demonstrates a lack of comprehensive assessment and can be seen as substandard care. An approach that prioritizes addressing only easily modifiable local factors, such as pressure and desiccation, without a thorough evaluation of perfusion or systemic factors, is also incorrect. While these local factors are important, neglecting perfusion can lead to inadequate oxygen and nutrient delivery to the wound bed, severely hindering healing regardless of other interventions. Similarly, overlooking systemic factors means the patient's overall health status, which significantly influences their ability to heal, is not adequately managed. This selective focus can result in a superficial treatment plan that fails to achieve optimal outcomes and may not meet regulatory expectations for thorough wound management. An approach that relies solely on the patient's self-reported symptoms without objective assessment of local wound characteristics and systemic indicators is professionally unacceptable. This method is flawed because subjective reporting can be incomplete or inaccurate, and it bypasses the essential clinical skills and diagnostic tools expected of a CWS. Regulatory bodies and professional standards require objective data collection, including wound measurements, visual inspection, and consideration of objective systemic health data to guide treatment decisions. Relying only on patient reports risks misdiagnosis and inappropriate interventions, failing to meet the standard of care. Professionals should employ a systematic, evidence-based decision-making process that begins with a comprehensive patient assessment. This assessment must encompass both local wound conditions and the patient's systemic health status. Following the assessment, the CWS should identify all potential barriers to healing, prioritize interventions based on their potential impact and the patient's overall clinical picture, and develop a collaborative, individualized treatment plan. Regular reassessment and adjustment of the plan are crucial. This process ensures that care is patient-centered, effective, and compliant with regulatory and ethical standards. Question 2. The control framework reveals that a certified wound specialist, CWS, is evaluating a patient experiencing discomfort related to a chronic wound. Which of the following approaches to pain assessment best aligns with the principles of comprehensive and effective wound care, ensuring all critical aspects of the patient's pain experience are captured for appropriate intervention? Option A. Focusing exclusively on the visual appearance of the wound to infer the level of pain the patient is experiencing. Option B. Relying on the patient's statement that the wound hurts and proceeding with routine dressing changes without further inquiry. Option C. Asking the patient to describe the pain's location, its quality, e.g., sharp, burning, aching, its intensity using a validated scale, and identifying factors that worsen or improve it. Option D. Primarily utilizing a 0-10 numerical rating scale to quantify pain intensity and documenting this single data point. The correct answer is D. Primarily utilizing a 0-10 numerical rating scale to quantify pain intensity and documenting this single data point. Explanation. This scenario is professionally challenging because accurately assessing and documenting pain in a wound patient is fundamental to effective care, yet it can be subjective and influenced by various factors. The certified wound specialist, CWS, must navigate the patient's subjective experience with objective clinical findings and adhere to established standards of practice, which are often implicitly or explicitly guided by regulatory frameworks and professional ethical codes. The challenge lies in ensuring that the assessment is comprehensive, consistent, and leads to appropriate interventions, all while maintaining patient dignity and autonomy. The correct approach involves a multifaceted pain assessment that systematically explores the location, intensity, type, and influencing factors of the patient's pain. This aligns with best practices in pain management, which are often reflected in professional guidelines and implicitly supported by regulatory requirements for quality patient care. By thoroughly documenting these elements, the CWS provides a clear picture of the patient's pain experience, enabling targeted treatment strategies and facilitating communication among the healthcare team. This comprehensive approach is ethically sound as it prioritizes patient comfort and well-being, and it is professionally responsible as it ensures accurate data for clinical decision-making and potential regulatory review. An approach that focuses solely on a numerical pain scale without exploring the qualitative aspects of pain type, location, aggravating/alleviating factors is insufficient. While numerical scales provide a measure of intensity, they fail to capture the full complexity of the patient's pain experience, potentially leading to undertreatment or inappropriate interventions. This oversight could be considered a failure to meet the standard of care expected of a CWS, as it neglects crucial information for effective pain management. Another incorrect approach would be to rely solely on the patient's verbal report of pain without attempting to correlate it with observable signs or the wound's condition. While patient self-report is paramount, a skilled clinician also observes for nonverbal cues and considers the physical context of the wound. Ignoring these elements can lead to a superficial assessment. Finally, assuming pain is solely related to the wound itself without considering other potential contributing factors, e.g., musculoskeletal pain, neuropathic pain unrelated to the wound, psychological distress, is an incomplete assessment. This can lead to a failure to address the root cause of the patient's discomfort, thus failing to provide holistic care. Professionals should employ a systematic pain assessment process that includes open-ended questions to understand the patient's experience, utilizes validated pain assessment tools, including numerical scales, but not exclusively, and integrates this subjective data with objective clinical observations and the patient's overall health status. This ensures a comprehensive understanding that guides effective and ethical wound care. Question 3. Operational review demonstrates a patient presenting with a chronic wound exhibiting persistent erythema, edema, and serosanguinous exudate for over 2 weeks, with no clear signs of infection. The wound bed is characterized by a significant amount of slough. Which of the following approaches best addresses the prolonged inflammatory phase of healing in this scenario? Aligning with Certified Wound Specialist, CWS, best practices and U.S. regulatory expectations. Option A. Increase the frequency of dressing changes to every 12 hours to manage the serosanguinous exudate. Option B. Prescribe a course of systemic corticosteroids to reduce inflammation. Option C. Implement sharp debridement to remove slough, followed by application of a hydrogel dressing to maintain a moist wound environment. Option D. Apply a topical broad-spectrum antimicrobial ointment to the wound bed. The correct answer is C. Implement sharp debridement to remove slough, followed by application of a hydrogel dressing to maintain a moist wound environment. Explanation. Scenario analysis. This scenario presents a common challenge in wound management. A patient exhibiting signs of delayed or aberrant inflammation, which is critical for initiating the healing cascade. The professional challenge lies in accurately identifying the underlying cause of the prolonged inflammatory phase and implementing an evidence-based, patient-centered intervention that aligns with CWS scope of practice and relevant U.S. regulatory guidelines for healthcare professionals. Misinterpreting the inflammatory response or applying inappropriate interventions can lead to delayed healing, increased risk of infection, and patient harm, necessitating careful clinical judgment and adherence to established protocols. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's wound and systemic factors contributing to the inflammatory response. This includes evaluating the wound bed for signs of infection, assessing the patient's nutritional status, glycemic control, and any comorbidities that might impair healing. Based on this assessment, the professional would then select an intervention that specifically targets the dysregulated inflammatory phase, such as debridement to remove non-viable tissue that perpetuates inflammation, or the application of a dressing designed to manage exudate and promote a moist wound environment conducive to healing. This approach is justified by the CWS scope of practice, which emphasizes the assessment, diagnosis, and management of wounds, and by U.S. healthcare regulations that mandate evidence-based practice and patient safety. The focus is on addressing the root cause of the prolonged inflammation, aligning with the principles of wound healing and regulatory expectations for competent care. Incorrect approaches analysis. One incorrect approach involves solely focusing on topical antimicrobial therapy without a thorough assessment of the inflammatory phase. This fails to address the underlying issue of dysregulated inflammation and may mask or exacerbate the problem, potentially leading to antibiotic resistance and delayed healing. It deviates from best practices by not considering the multifaceted nature of inflammation. Another incorrect approach is to simply increase the frequency of dressing changes without identifying the cause of excessive exudate or the persistent inflammatory signs. This is a reactive measure that does not address the root cause of the prolonged inflammation and can be resource-intensive without providing therapeutic benefit. It lacks a systematic, problem-solving approach. A third incorrect approach is to recommend systemic corticosteroids without a physician's order and a clear indication for their use in managing the specific inflammatory component of the wound. This oversteps the CWS scope of practice, as prescribing systemic medications is outside the purview of most advanced practice nurses and requires physician oversight. It also carries significant risks of further impairing immune function and delaying healing. Professional reasoning. Professionals facing this situation should employ a systematic approach. 1. Comprehensive assessment. Thoroughly evaluate the wound bed, peri-wound skin, exudate characteristics, and patient's overall health status, including comorbidities and nutritional status. 2. Differential diagnosis. Consider potential causes for the prolonged inflammatory phase, such as infection, foreign bodies pressure, or underlying systemic conditions. 3. Evidence-based intervention selection. Choose interventions supported by current research and clinical guidelines that directly address the identified cause of dysregulated inflammation. This might include debridement, appropriate dressing selection, or management of systemic factors. 4. Collaboration and consultation. Consult with the physician or other members of the healthcare team when necessary, particularly for complex cases or when interventions fall outside the CWS scope of practice. 5. Patient education. Educate the patient and their caregivers about the wound healing process, the rationale for interventions, and signs of worsening or improvement. 6. Documentation. Meticulously document all assessments, intervention, and patient responses, adhering to facility policies and regulatory requirements. Question 4. The audit findings indicate a pattern of delayed healing in patients presenting with neuropathic ulcers. Which of the following assessment and management strategies best reflects the certified wound specialist's role in addressing this issue, adhering to U.S. regulatory frameworks and established wound care guidelines? Option A. Delegate the primary responsibility for managing the neuropathic ulcer to the patient's primary care physician, providing only basic wound dressing recommendations. Option B. Focus primarily on debridement of necrotic tissue and application of a standard antimicrobial dressing, assuming the underlying cause is likely pressure-related. Option C. Initiate treatment with topical growth factors and compression therapy, as these are generally effective for most chronic ulcers, regardless of specific etiology. Option D. Prioritize a comprehensive neurological assessment to identify the specific type and severity of neuropathy, followed by a multimodal management plan that includes aggressive offloading, glycemic control, and appropriate advanced wound therapies tailored to the identified etiology. The correct answer is D. Prioritize a comprehensive neurological assessment to identify the specific type and severity of neuropathy, followed by a multimodal management plan that includes aggressive offloading, glycemic control, and appropriate advanced wound therapies tailored to the identified etiology. Explanation. This scenario presents a professional challenge due to the need to differentiate between etiologies and management strategies for neuropathic ulcers, which can have overlapping presentations but require distinct interventions. The Certified Wound Specialist, CWS, must apply evidence-based practice within the scope of their professional responsibilities, adhering to established clinical guidelines and ethical principles. Careful judgment is required to avoid misdiagnosis and inappropriate treatment, which could lead to delayed healing, increased patient morbidity, and potential legal or professional repercussions. The correct approach involves a comprehensive assessment that prioritizes identifying the underlying cause of the neuropathic ulcer. This includes a thorough patient history, physical examination focusing on neurological deficits, e.g., loss of protective sensation, altered vibratory sense, diminished reflexes, vascular assessment to rule out arterial insufficiency, and evaluation for pressure points or shear forces. Management should then be tailored to the specific etiology, addressing factors such as glycemic control in diabetic neuropathy, nutritional support, offloading pressure, appropriate debridement, infection control, and the use of advanced wound care modalities. This approach aligns with the CWS Code of Ethics, which mandates providing competent care based on scientific knowledge and ethical principles, and the CWS scope of practice, which emphasizes the assessment, diagnosis, and management of wounds. An incorrect approach would be to solely focus on the wound bed appearance, without a thorough etiological investigation. This could lead to applying generic wound care protocols that do not address the root cause of the neuropathy, resulting in prolonged healing times and potential complications. Another incorrect approach would be to initiate aggressive debridement without adequately assessing for underlying vascular compromise, which could exacerbate ischemia and lead to further tissue damage. Furthermore, failing to involve other healthcare professionals, such as endocrinologists or vascular surgeons, when indicated by the assessment, represents a failure to provide collaborative and comprehensive care, potentially violating ethical obligations to act in the patient's best interest. Professionals should employ a systematic decision-making process that begins with a comprehensive patient assessment, followed by differential diagnosis, evidence-based treatment planning, implementation, and ongoing evaluation. This process should be guided by established clinical practice guidelines and a commitment to patient-centered care, ensuring that all contributing factors to the wound are addressed. Question 5. Market research demonstrates that the integration of high-quality wound photography significantly enhances clinical decision-making and patient outcomes. A certified wound specialist, CWS, is preparing to document a complex lower extremity wound. To optimize the process while strictly adhering to U.S. regulatory frameworks, which of the following actions best balances clinical utility with legal and ethical considerations? Option A. Obtain explicit, written informed consent from the patient that details the purpose of wound photography, how the images will be used and stored, and who will have access, while also employing photographic techniques to minimize the visibility of any non-wound-related patient identifiers in the images before securely storing them in the patient's EHR. Option B. Capture photographs of the wound, including the patient's face for complete identification, and store them on a password-protected personal laptop for easy access during follow-up consultations. Option C. Take detailed photographs of the wound, ensuring clear visualization of tissue characteristics, exudate and surrounding skin, and then upload them to a secure, HIPAA-compliant electronic health record system, assuming general consent for treatment implies consent for documentation. Option D. Use a smartphone to take quick, informal photos of the wound to quickly share with a colleague for a second opinion, without documenting the patient's name on the image file itself. The correct answer is C. Take detailed photographs of the wound, ensuring clear visualization of tissue characteristics, exudate and surrounding skin, and then upload them to a secure, HIPAA-compliant electronic health record system, assuming general consent for treatment implies consent for documentation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the imperative of accurate and comprehensive wound documentation with strict adherence to patient privacy regulations, specifically the Health Insurance Portability and Accountability Act, HIPAA, in the United States. The use of wound photography, while invaluable for tracking progress and informing treatment, introduces significant risks related to protected health information. If not handled with extreme care, the Certified Wound Specialist, CWS, must navigate the technical aspects of photography, the legal requirements of documentation, and the ethical considerations of patient consent and data security. Failure to do so can result in legal penalties, damage to professional reputation, and erosion of patient trust. Correct approach analysis. The correct approach involves obtaining explicit, written informed consent from the patient or their legal representative before taking any photographs. This consent must clearly outline the purpose of the photography, how the images will be used, who will have access to them, and the duration for which they will be stored. Furthermore, the photographs themselves must be taken in a manner that minimizes the visibility of any identifying patient information not directly relevant to the wound assessment. This includes careful framing to exclude faces, tattoos, or other unique identifiers, and ensuring that any metadata associated with the digital image does not inadvertently reveal PHI. The images must then be securely stored and integrated into the patient's electronic health record (EHR) or other secure, compliant documentation system, with access strictly limited to authorized healthcare professionals involved in the patient's care. This comprehensive approach ensures that wound photography serves its clinical purpose while upholding all HIPAA requirements for patient privacy and data security. Incorrect approaches analysis. Taking photographs without obtaining prior written informed consent, even if the intent is solely for clinical documentation, is a direct violation of HIPAA. This failure to secure consent means the patient has not been adequately informed about the collection and use of their health information, which includes images of their body. Another incorrect approach is to take photographs that clearly display the patient's face or other identifiable features without specific consent for such broader identification. This constitutes a breach of privacy because the images capture more PHI than is clinically necessary for wound assessment and treatment planning. Furthermore, storing wound photographs on unsecured personal devices or in unencrypted cloud storage, or sharing them via non-secure communication channels represents a significant failure to protect PHI from unauthorized access or disclosure, again violating HIPAA security and privacy rules. Professional reasoning. Professionals in wound care must adopt a proactive and compliant mindset when incorporating wound photography into their practice. The decision-making process should begin with a thorough understanding of the legal and ethical obligations surrounding patient data. Before any photographic equipment is used, the CWS must ensure that a robust consent process is in place, tailored to the specific use of wound imagery. This involves educating the patient about the benefits and risks and obtaining their voluntary agreement. When capturing images, the focus should always be on the wound itself, employing techniques to anonymize the patient as much as possible while retaining clinical utility. Finally, the secure management of these images, from capture to storage and eventual disposal, must be integrated into the facility's overall HIPAA compliance plan. This systematic approach prioritizes patient rights and data integrity, ensuring that advanced documentation techniques enhance care without compromising privacy. Question 6. Benchmark analysis indicates that a patient presenting with a wound in the maturation phase exhibits a scar that appears somewhat raised and firm to palpation, with minimal visible wound contraction over the past 2 weeks. The patient reports no significant increase in pain. Which of the following approaches best assesses the effectiveness of the maturation phase in this scenario? Option A. Conduct a detailed palpation of the scar tissue for pliability and adherence, observe the degree of wound contraction, and assess the overall quality of the newly formed tissue for signs of excessive or inadequate collagen deposition and cross-linking. Option B. Evaluate the wound solely based on the absence of infection indicators, assuming that if no infection is present, the maturation phase is proceeding optimally. Option C. Focus the assessment on the patient's emotional response to the scar and their satisfaction with its cosmetic outcome. Option D. Rely primarily on the patient's self-reported pain levels and subjective feedback regarding the wound's appearance to gauge the healing progress. The correct answer is A. Conduct a detailed palpation of the scar tissue for pliability and adherence, observe the degree of wound contraction, and assess the overall quality of the newly formed tissue for signs of excessive or inadequate collagen deposition and cross-linking. Explanation: this scenario is professionally challenging because it requires the Certified Wound Specialist, CWS, to assess the effectiveness of the maturation phase of wound healing, specifically focusing on collagen cross-linking, scar formation, and wound contraction, within the context of a patient's overall well-being and the established standards of care. The CWS must integrate knowledge of the biological processes of wound repair with practical clinical observation and patient-centered care, all while adhering to the regulatory framework governing wound care practice in the United States. The risk assessment component is crucial for identifying potential complications or deviations from optimal healing, which could impact patient outcomes and necessitate adjustments to the treatment plan. The correct approach involves a comprehensive clinical assessment that directly evaluates the physical characteristics of the healing wound and the patient's response. This includes palpating scar tissue for pliability and adherence, observing the degree of wound contraction, and assessing the overall quality of the newly formed tissue for signs of excessive or inadequate collagen deposition and cross-linking. This approach aligns with the CWS scope of practice, which mandates evidence-based assessment and management of chronic wounds. Ethical considerations dictate that the CWS must prioritize patient safety and optimal healing by accurately identifying and addressing any impediments to the maturation phase. Regulatory guidelines, such as those established by the National Alliance of Wound Care and Ostomy (NAWC) for CWS certification, emphasize the importance of thorough patient assessment and the application of scientific principles to wound management. An incorrect approach that relies solely on patient self-report without objective clinical findings would be professionally unacceptable. This fails to meet the standard of care for a CWS, as it bypasses the essential physical examination required to assess the biological processes of wound healing. Ethically, it compromises patient safety by potentially overlooking critical objective data that could indicate poor collagen cross-linking or inadequate wound contraction, leading to delayed healing or complications. Another incorrect approach that focuses exclusively on the patient's subjective experience of pain, without correlating it to the objective signs of the maturation phase, is also professionally deficient. While pain is an important patient indicator, it is not a direct measure of collagen cross-linking or scar formation. This approach neglects the core competencies of a CWS in evaluating the structural and functional aspects of wound repair. Regulatory frameworks implicitly require objective data to support clinical decision-making. A third incorrect approach that prioritizes the aesthetic appearance of the scar over its functional integrity would be a significant ethical and professional failure. While aesthetics can be a consideration in some wound management contexts, the primary focus during the maturation phase is on the functional strength and pliability of the scar tissue, which is directly related to collagen cross-linking and wound contraction. Overlooking functional deficits in favor of appearance could lead to long-term mobility issues or recurrent breakdown, violating the principle of beneficence. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough objective physical assessment of the wound, focusing on the characteristics of scar tissue, wound bed, and surrounding skin. Second, correlate these objective findings with the patient's subjective report and overall health status. Third, interpret the findings in light of the expected biological processes of the maturation phase, considering factors that might impede collagen cross-linking or wound contraction. Finally, develop and implement a treatment plan based on this comprehensive assessment, ensuring it aligns with current evidence-based practices and regulatory requirements for wound care professionals in the United States. Question 7. Cost-benefit analysis shows that a proactive, comprehensive risk assessment for wound infection, considering the patient's entire clinical profile and subtle indicators, is more effective than reactive interventions based solely on overt symptoms. A certified wound specialist is evaluating a patient with diabetes and peripheral neuropathy who presents with a non-healing lower extremity wound. The patient reports mild discomfort but denies significant pain, and the wound bed appears slightly erythematous with minimal serous exudate. Which of the following approaches best reflects a risk assessment strategy for potential wound infection in this patient? Option A. Conduct a thorough assessment of the patient's systemic and local signs of infection, considering their comorbidities and potential for atypical presentations, before initiating any specific treatment for infection. Option B. Focus solely on improving the wound bed appearance and offloading the wound, assuming the mild discomfort and serous exudate are not indicative of infection. Option C. Implement a broad-spectrum antibiotic regimen immediately due to the presence of a non-healing wound and potential for infection in a diabetic patient. Option D. Defer any specific assessment for infection until the patient reports significant pain or observes purulent drainage, as these are the most definitive signs. The correct answer is C. Implement a broad-spectrum antibiotic regimen immediately due to the presence of a non-healing wound and potential for infection in a diabetic patient. Explanation: scenario analysis. This scenario is professionally challenging because accurately assessing wound infection in a patient with multiple comorbidities requires a nuanced understanding of both typical and atypical presentations. The presence of underlying conditions can mask or mimic signs of infection, leading to delayed or incorrect management. The certified wound specialist, CWS, must integrate clinical observation, patient history, and knowledge of infection pathophysiology to make timely and appropriate decisions, balancing the risks of overtreatment with the dangers of undertreatment. Correct approach analysis. The correct approach involves a comprehensive risk assessment that systematically evaluates the patient's overall health status, wound characteristics, and potential exposure to pathogens. This approach aligns with the CWS Code of Ethics, which mandates providing competent care and acting in the best interest of the patient. Specifically, it emphasizes a holistic view, considering factors beyond just the immediate wound site, which is crucial for identifying subtle signs of infection or increased susceptibility. This aligns with best practices in wound management, which advocate for individualized care plans based on thorough patient evaluation. Incorrect approach is analysis. An approach that solely focuses on the most obvious signs of infection, such as purulent drainage, without considering the patient's broader clinical picture, is ethically flawed. This narrow focus can lead to overlooking early or atypical signs of infection in immunocompromised or elderly patients, potentially violating the duty of care. An approach that prioritizes patient comfort over thorough assessment, by avoiding any manipulation of the wound or questioning the patient about pain, is also professionally unacceptable. While patient comfort is important, it should not supersede the imperative to accurately diagnose and manage a potentially serious condition like infection. This could be seen as a failure to uphold professional standards of care and could lead to patient harm. An approach that relies solely on the patient's subjective report of symptoms without objective clinical assessment is insufficient. While patient reporting is vital, it must be corroborated with objective findings. This approach risks misinterpreting symptoms or missing critical objective signs of infection, which is a deviation from evidence-based practice and could result in delayed or inappropriate treatment. Professional reasoning. Professionals should employ a systematic evidence-based approach to infection assessment. This involves 1. Gathering a thorough patient history, including comorbidities, immune status, and recent exposures. 2. Performing a comprehensive physical examination of the wound, noting all cardinal signs of inflammation and infection, redness, warmth, swelling, pain, purulent drainage, as well as any systemic signs, fever, elevated white blood cell count. 3. Considering the patient's overall clinical status and risk factors. 4. Documenting all findings meticulously. 5. Collaborating with the healthcare team, including physicians, to determine the most appropriate diagnostic and therapeutic interventions. This structured decision-making process ensures that all relevant factors are considered, leading to optimal patient outcomes. Question 8. Process analysis reveals a certified wound specialist, CWS, is evaluating a chronic pressure injury exhibiting moderate purulent exudate and surrounding erythema. The CWS must determine the most appropriate course of action to manage the wound bioburden and prevent potential infection, strictly adhering to U.S. regulatory frameworks and professional guidelines. Which of the following approaches best aligns with these requirements? Option A. Apply a silver-impregnated dressing and instruct the patient on basic wound hygiene without further assessment. Option B. Immediately prescribe broad-spectrum systemic antibiotics and apply a standard absorbent dressing. Option C. Document the purulent exudate and erythema and await a physician's order for any intervention. Option D. Perform a comprehensive wound assessment to differentiate between colonization and infection, and based on findings, consider topical antimicrobials or debridement, and if infection is confirmed, initiate appropriate antibiotic therapy. The correct answer is B. Immediately prescribe broad-spectrum systemic antibiotics and apply a standard absorbent dressing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified wound specialist, CWS, to balance immediate patient needs with strict adherence to regulatory guidelines for infection control. The presence of a visible purulent exudate and signs of inflammation in a chronic wound necessitates prompt intervention, but the specific actions taken must align with established protocols to prevent the spread of infection and ensure patient safety. Misinterpreting the severity of bioburden or applying inappropriate interventions can lead to patient harm, increased healthcare costs, and regulatory noncompliance. The CWS must exercise critical judgment in assessing the wound, understanding the nuances of bioburden versus infection, and selecting interventions that are both clinically effective and compliant with regulatory frameworks. Correct approach analysis. The correct approach involves a comprehensive wound assessment to differentiate between colonization, critical colonization, and infection, followed by the selection of appropriate antimicrobial therapy and or advanced wound care modalities based on this assessment, and in accordance with established clinical practice guidelines and regulatory requirements. This approach prioritizes evidence-based practice and patient safety by ensuring that interventions are targeted and effective. For a CWS in the U.S., this aligns with the principles of the Centers for Medicare and Medicaid Services, CMS, conditions of participation for healthcare facilities, which mandate infection prevention and control programs. Furthermore, professional organizations like the Association for the Advancement of Wound Care, AWC, and the Wound Ostomy and Continence Nurses, WOCN, Society provide guidelines that emphasize a systematic approach to wound management, including the appropriate use of antimicrobials and infection control measures, all of which are implicitly supported by regulatory expectations for quality patient care. Incorrect approach is analysis. An incorrect approach would be to immediately initiate broad-spectrum systemic antibiotics solely based on the presence of purulent exudate without a thorough assessment to confirm clinical infection. This fails to adhere to antimicrobial stewardship principles, which are increasingly emphasized by regulatory bodies like CMS and the Joint Commission to Combat Antibiotic Resistance. Overprescription of antibiotics can lead to adverse patient effects and contribute to the development of resistant organisms. Another incorrect approach would be to solely rely on topical antimicrobial dressings without considering the need for systemic treatment if a deep or widespread infection is suspected, or without a proper assessment to determine if topical agents are indicated at all. This neglects the potential for systemic involvement and may delay appropriate care. Finally, delaying any intervention or further assessment while awaiting laboratory results without implementing basic infection control precautions would be a failure to act promptly in a potentially infectious situation, which contravenes general infection control mandates. Professional reasoning. Professionals should approach such situations by first conducting a thorough, systematic wound assessment. This includes evaluating the wound bed, exudate characteristics, peri-wound skin, and signs and symptoms of local or systemic infection. Based on this assessment, the CWS should consult relevant clinical practice guidelines and institutional policies, which are often informed by regulatory requirements. The decision-making process should prioritize patient safety, evidence-based interventions, and antimicrobial stewardship. If infection is suspected, appropriate diagnostic measures, e.g., wound culture, should be considered, and treatment should be initiated in accordance with established protocols, balancing the need for effective treatment with the risks of overtreatment. Continuous monitoring and reassessment are crucial to adjust the treatment plan as needed. Question 9. The performance metrics show a consistent pattern of delayed healing in a cohort of patients with chronic wounds. As a certified wound specialist, you are reviewing a specific patient's case where the wound bed appears to be improving, but the healing trajectory is still suboptimal. What is the most critical aspect of your assessment to identify potential barriers to healing that might be overlooked by focusing solely on the wound bed? Option A. A detailed examination of the wound edges for signs of epithelial advancement, maceration, or callus, coupled with precise measurement of any undermining or tunneling, and a thorough evaluation of the peri-wound skin for erythema, edema, or breakdown. Option B. A review of the patient's nutritional status and laboratory values, focusing on albumin and prealbumin levels. Option C. An assessment of the patient's pain levels and their impact on mobility and wound care adherence. Option D. A comprehensive analysis of the patient's medication list for any drugs that might impede wound healing. The correct answer is A. A detailed examination of the wound edges for signs of epithelial advancement, maceration, or callus, coupled with precise measurement of any undermining or tunneling, and a thorough evaluation of the peri-wound skin for erythema, edema, or breakdown. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified wound specialist, CWS, to interpret subtle visual cues of wound edges and peri-wound skin, which are critical indicators of healing or deterioration. The presence of undermining and tunneling, along with changes in peri-wound skin integrity, necessitates a precise assessment to guide appropriate treatment. Misinterpretation can lead to delayed healing, increased risk of infection, and patient harm, all of which have implications for professional accountability and adherence to best practices. Correct approach analysis. The correct approach involves a comprehensive assessment of the wound edges for signs of epithelialization, maceration, or callus formation. It also requires careful palpation to identify and measure undermining and tunneling, noting their depth and direction. The peri-wound skin must be evaluated for erythema, edema, warmth, induration, or breakdown. This systematic, detailed examination allows for accurate staging and characterization of the wound, which is fundamental to developing an evidence-based treatment plan. Adherence to the CWS certification standards and the principles of wound care outlined in relevant professional guidelines, e.g., those promoted by the Association for the Advancement of Wound Care Professionals, if applicable within the U.S. regulatory framework, mandates such thoroughness. This approach ensures that interventions are targeted to the specific pathological processes observed, promoting optimal wound healing and patient safety. Incorrect approach is analysis. One incorrect approach is to focus solely on the wound bed appearance, neglecting the wound edges and peri-wound skin. This failure to conduct a complete assessment is a direct violation of professional standards of care. It can lead to overlooking critical signs of infection or impaired healing that are manifested in the surrounding tissues. Another incorrect approach is to document findings without a systematic method for quantifying undermining and tunneling, such as failing to measure depth or direction. This lack of objective data makes it impossible to track changes over time and assess the effectiveness of interventions, undermining the principles of evidence-based practice and accountability. A third incorrect approach is to attribute peri-wound skin changes solely to external factors like incontinence, without considering underlying wound-related issues such as exudate management or pressure, demonstrating a failure to integrate all relevant assessment data into a holistic understanding of the wound status. Professional reasoning. Professionals should employ a decision-making framework that prioritizes a systematic and comprehensive assessment. This begins with a visual inspection of the entire wound area, including edges and peri-wound skin, followed by palpation to assess undermining and tunneling. Objective measurements and detailed documentation are crucial for tracking progress and communicating findings. When faced with complex presentations, professionals should consult established wound care protocols and, if necessary, seek input from interdisciplinary team members. The framework should emphasize the ethical obligation to provide competent and compassionate care, ensuring that all assessment data informs a safe and effective treatment plan. Question 10. The monitoring system demonstrates a stage Roman III pressure injury on the sacrum with moderate exudate and surrounding erythema. The patient, an 85-year-old male with a history of diabetes and peripheral neuropathy, reports the wound appeared suddenly, about 2 weeks ago after a fall. He states he has not sought medical attention for it previously and has been applying over-the-counter antibiotic ointment. Which of the following approaches to wound assessment and management is most appropriate given this initial information? Option A. Conduct a thorough wound history, including detailed inquiry into the fall, previous skin integrity issues, mobility, nutritional status, and current medications, before finalizing the treatment plan. Option B. Recommend a specialized mattress and repositioning schedule, as pressure is the most likely etiology, and defer further wound assessment until the patient is more stable. Option C. Immediately initiate a debridement protocol and apply a hydrocolloid dressing, as the wound appears to be progressing rapidly. Option D. Focus on aggressive topical antimicrobial therapy and frequent dressing changes to manage the exudate and erythema. The correct answer is C. Immediately initiate a debridement protocol and apply a hydrocolloid dressing, as the wound appears to be progressing rapidly. Explanation. This scenario presents a professional challenge due to the critical nature of wound history and accurate diagnosis and treatment planning, directly impacting patient outcomes. The Certified Wound Specialist, CWS, must synthesize complex, often incomplete, patient information to establish a comprehensive understanding of the wound's genesis and progression. This requires meticulous data gathering, critical analysis, and adherence to professional standards of care, all within the regulatory framework governing healthcare practice. The correct approach involves a systematic and thorough collection of all relevant wound history components: etiology, onset, previous treatments, patient's medical history, and social history. This comprehensive data forms the foundation for differential diagnosis, identification of contributing factors, and the development of an individualized, evidence-based treatment plan. Regulatory frameworks, such as those established by the National Council on Skin and Wound, NCSW, for CWS certification, emphasize the importance of a holistic patient assessment, which inherently includes a detailed history. Ethical principles of beneficence and non-maleficence mandate that practitioners gather sufficient information to provide safe and effective care, avoiding harm that could result from an incomplete or inaccurate assessment. An approach that focuses solely on the current wound appearance without delving into its history is professionally unacceptable. This failure to gather essential historical data violates the principle of comprehensive assessment, potentially leading to misdiagnosis and inappropriate treatment. It neglects the crucial role of underlying etiologies, e.g., vascular insufficiency, pressure, trauma, and previous treatment responses in guiding current management. Such an oversight could also lead to a breach of professional standards of care, as established by professional organizations and potentially state licensing boards, which expect practitioners to conduct thorough patient evaluations. Another incorrect approach is to rely solely on patient self-reporting without independent verification or further probing, especially when the history is vague or contradictory. Patient input is vital. A CWS has a professional responsibility to seek clarification, ask targeted questions, and, where appropriate, consult with other healthcare providers or review medical records to ensure accuracy. Failure to do so can result in a flawed understanding of the wound's trajectory and contributing factors, potentially leading to ineffective or even harmful interventions. This also risks violating the ethical duty to provide competent care based on reliable information. Finally, An approach that prioritizes immediate wound intervention over a complete history is also professionally unsound. While urgent wound management may be necessary in some acute situations, a thorough understanding of the wound's history is almost always paramount for long-term healing and preventing recurrence. Skipping this crucial step can lead to treating symptoms without addressing root causes, resulting in prolonged healing times, increased costs, and potential complications. This demonstrates a lack of professional judgment and a failure to adhere to best practices in wound care, which are underpinned by regulatory expectations for evidence-based and patient-centered care. The professional decision-making process for similar situations should involve a structured approach. 1. Initiate a comprehensive patient interview, systematically covering all aspects of wound history. 2. Employ active listening and open-ended questions to encourage detailed responses. 3. Utilize targeted probing questions to clarify ambiguities or gather missing information. 4. Corroborate patient-reported history with available medical records, and when possible, consult with other members of the healthcare team. 5. Critically analyze the gathered history in conjunction with the physical wound assessment to formulate a differential diagnosis and develop an individualized treatment plan. 6. Continuously reassess the patient's history and wound status throughout the course of treatment. Question 11. The risk matrix shows a high probability of regulatory scrutiny regarding the completeness and accuracy of wound documentation. A certified wound specialist, CWS, is performing a comprehensive wound assessment on a new patient presenting with a complex lower extremity ulcer. Which of the following approaches best mitigates the identified risk while ensuring optimal patient care? Option A. Focus primarily on the patient's subjective report of pain and discomfort, making a brief note that the wound appears to be improving visually. Option B. Conduct a thorough, systematic head-to-toe assessment of the wound and surrounding tissues, documenting all findings objectively using standardized terminology and ensuring the documentation is completed promptly. Option C. Rely on a general description of the wound's appearance, such as ulcer present, and defer detailed documentation until the next scheduled visit. Option D. Document only the most obvious visual changes in the wound, such as the presence of redness or swelling, without detailing specific measurements or tissue characteristics. Correct answer is B. Conduct a thorough, systematic head-to-toe assessment of the wound and surrounding tissues, documenting all findings objectively using standardized terminology and ensuring the documentation is completed promptly. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified wound specialist, CWS, to balance the immediate need for comprehensive wound assessment with the legal and ethical imperative of accurate and timely documentation. Inaccurate or incomplete documentation can lead to suboptimal patient care, legal repercussions, and failure to meet regulatory standards. The CWS must exercise sound professional judgment to ensure all critical aspects of the wound are captured effectively. Correct approach analysis. The correct approach involves a systematic head-to-toe assessment of the wound, including its location, size, depth, exudate characteristics, tissue type, peri-wound skin condition, and any signs of infection. This detailed assessment must then be meticulously documented in the patient's medical record, using clear, objective language and standardized terminology. This aligns with the ethical obligation to provide competent care and the regulatory requirement for accurate medical records, which serve as a legal document and a basis for communication among the healthcare team. Adherence to established CWS practice standards and guidelines ensures that all relevant information is captured, facilitating appropriate treatment planning and continuity of care. Incorrect approach is analysis. An approach that prioritizes only the visual appearance of the wound without a systematic assessment or detailed documentation fails to capture crucial clinical data. This can lead to misdiagnosis, inappropriate treatment, and a lack of objective evidence of the wound's progression or regression, potentially violating standards of care and regulatory documentation requirements. An approach that focuses solely on documenting subjective patient complaints without a thorough objective wound assessment is insufficient. While patient reports are important, they do not replace the need for comprehensive clinical evaluation and objective findings, which are essential for effective wound management and legal defensibility. This approach risks overlooking critical physical signs and symptoms. An approach that relies on vague or generalized descriptions, such as "wound looks better," without specific details about changes in size, depth, exudate, or tissue type, is inadequate. This lack of specificity hinders objective tracking of progress, makes it difficult for other clinicians to understand the wound's status, and may not meet the standards for comprehensive medical record keeping required by regulatory bodies. Professional reasoning. Professionals should employ a structured approach to wound assessment and documentation. This involves utilizing a recognized assessment tool or framework, ensuring all components of the wound are evaluated, and then translating these findings into clear, concise, and objective documentation. Regular review of documentation practices against current regulatory guidelines and professional standards is essential to maintain competence and ensure patient safety. When in doubt, erring on the side of more detailed and objective documentation is generally advisable. Question 12. The evaluation methodology shows a patient admitted with a stage 2 pressure injury on the sacrum and identified as high risk for further pressure injury development due to immobility and poor nutritional status. The certified wound specialist is tasked with developing an immediate care plan. Which of the following approaches best reflects the required regulatory and professional standards for pressure injury management in a U.S. healthcare setting? Option A. Initiate a plan to consult with the physician for a higher-level pressure injury stage, assuming the current staging may be inaccurate, and defer further interventions until a revised staging is confirmed. Option B. Implement a comprehensive plan that includes repositioning every 2 hours, application of a moisture barrier cream, a stage 2 pressure injury dressing, and a nutritional consult to address identified risk factors and the current stage of the injury. Option C. Recommend a specialized, high-cost support surface for the patient's bed and chair, prioritizing this intervention over other preventative measures due to the high-risk status. Option D. Focus solely on dressing the stage 2 pressure injury with a hydrocolloid and monitor for improvement, without addressing the underlying risk factors of immobility and poor nutrition. The correct answer is B. Implement a comprehensive plan that includes repositioning every 2 hours, application of a moisture barrier cream, a stage 2 pressure injury dressing, and a nutritional consult to address identified risk factors and the current stage of the injury. Explanation. The evaluation methodology shows a scenario requiring a certified wound specialist, CWS, to navigate the complexities of pressure injury management within a U.S. regulatory context, specifically adhering to guidelines relevant to healthcare facilities. This scenario is professionally challenging because it demands not only clinical expertise in pressure injury assessment and treatment, but also a thorough understanding of regulatory requirements for patient care and documentation, particularly concerning prevention and staging. The interplay between clinical judgment, patient advocacy, and adherence to established standards like those from the National Pressure Injury Advisory Panel, NPIAP, is critical. The correct approach involves a comprehensive assessment of the patient's risk factors using a validated tool, accurate staging of the pressure injury according to NPIAP guidelines, and the development of a multifaceted prevention and treatment plan that addresses the identified risks and the current stage of the injury. This aligns with the CWS's professional responsibility to provide evidence-based care and adhere to regulatory mandates that emphasize patient safety and quality outcomes. Ethical considerations, such as patient autonomy and the duty to prevent harm, are intrinsically linked to this approach. Regulatory justification stems from the Centers for Medicare and Medicaid Services, CMS, conditions of participation, which require facilities to have policies and procedures in place for the prevention and management of pressure injuries, and the expectation that care will meet professional standards, such as those promulgated by NPIAP. An incorrect approach that focuses solely on treating the visible wound, without a thorough risk assessment and staging, would fail to address the underlying causes and prevent recurrence, violating the principle of holistic patient care and potentially leading to regulatory noncompliance. This neglects the proactive and preventative aspects mandated by healthcare regulations. Another incorrect approach that involves delaying intervention or relying on anecdotal evidence rather than established NPIAP staging and evidence-based treatment protocols would be ethically unsound and professionally negligent, as it deviates from recognized standards of care and could result in patient harm. This also contraindicates regulatory expectations for timely and appropriate care. A third incorrect approach that prioritizes cost-saving measures over evidence-based prevention and treatment strategies without demonstrating equivalent or superior patient outcomes would be ethically problematic and could violate regulatory requirements for providing necessary and appropriate care. The professional reasoning framework for such situations should involve a systematic process. First, conduct a thorough patient assessment, including risk stratification using a validated tool. Second, accurately stage any existing pressure injuries using the NPIAP staging system. Third, develop an individualized, evidence-based care plan that incorporates both prevention strategies, e.g., repositioning, appropriate support surfaces, nutritional support, and treatment interventions tailored to the stage of the injury. Fourth, ensure meticulous documentation of all assessments, interventions, and patient responses. Finally, continuously monitor the patient's progress and adjust the care plan as needed, always in alignment with current regulatory requirements and professional ethical standards. Question 13. The efficiency study reveals that a significant portion of wound care consultations are being resolved with treatments targeting only the most visually apparent wound characteristic, rather than a comprehensive etiologic classification. This approach, while seemingly expedient, is leading to suboptimal patient outcomes and increased resource utilization. Considering the Certified Wound Specialist, CWS, role in advancing wound management, which of the following approaches best addresses this identified inefficiency while adhering to best practices in wound etiology and classification? Option A. Prioritize treatment interventions that address general wound healing principles, such as moisture balance and infection control, regardless of the specific underlying etiology, to ensure immediate management. Option B. Implement a standardized, multifaceted assessment protocol for all new wound consultations, requiring documentation of at least 3 potential etiologies with supporting evidence before initiating treatment, and a clear plan for diagnostic confirmation. Option C. Encourage providers to rely on patient self-reporting of wound cause as the primary determinant of etiology, supplementing with visual assessment only when discrepancies arise. Option D. Focus on training wound care providers to quickly identify the most common wound type based on visual cues and initiate a standard treatment protocol for that type, streamlining the initial encounter. The correct answer is B. Implement a standardized, multifaceted assessment protocol for all new wound consultations, requiring documentation of at least 3 potential etiologies with supporting evidence before initiating treatment, and a clear plan for diagnostic confirmation. Explanation. This scenario presents a professional challenge because accurately classifying wound etiology is foundational to effective treatment planning and resource allocation. Misclassification can lead to inappropriate interventions, delayed healing, increased patient morbidity, and inefficient use of healthcare resources, all of which have implications for adherence to professional standards and potentially regulatory guidelines concerning patient care quality and documentation. The Certified Wound Specialist, CWS, certification implies a commitment to evidence-based practice and adherence to established clinical guidelines, which are often informed by regulatory frameworks aimed at ensuring patient safety and optimal outcomes. The correct approach involves a systematic and comprehensive assessment of the patient's history, physical examination findings, and diagnostic data to definitively identify the primary and contributing etiologies of the wound. This aligns with the CWS certification's emphasis on advanced clinical judgment and the ethical imperative to provide patient-centered care based on accurate diagnosis. Regulatory frameworks, while not explicitly detailed here, generally support the principle of accurate diagnosis as a prerequisite for appropriate treatment and reimbursement, and professional guidelines for wound care specialists invariably stress the importance of a thorough etiologic workup. An incorrect approach that relies solely on the most visually apparent characteristic of the wound, such as its depth or presence of exudate, without a comprehensive etiologic investigation, fails to address the underlying cause. This can lead to the selection of ineffective treatments and may violate professional standards that mandate a root cause analysis for chronic or complex wounds. Another incorrect approach, which prioritizes a single, presumptive etiology based on limited information and proceeds with treatment without further investigation, risks misdiagnosis and inappropriate care. This neglects the complexity of wound healing and the potential for multifactorial etiologies, contravening the principle of thoroughness expected of a certified specialist. A third incorrect approach, which delegates the primary etiologic determination to a less experienced clinician without adequate oversight or a clear protocol for escalation, can lead to diagnostic errors and a breakdown in the continuity of care, potentially impacting patient safety and adherence to quality standards. Professionals should employ a decision-making process that begins with a broad differential diagnosis for wound etiology, systematically gathering data through patient history, physical examination, including assessment of vascular status, neurological function, and dermatological conditions, and appropriate diagnostic tests. This iterative process allows for the refinement of the diagnosis, ensuring that the most accurate etiologic classification is achieved before initiating a treatment plan. When faced with diagnostic uncertainty, seeking consultation with interdisciplinary colleagues or referring to specialized diagnostic services is a critical step in ensuring optimal patient care and upholding professional accountability. Question 14. Cost-benefit analysis shows that while basic measurement tools are readily available, the long-term benefits of accurate, reproducible wound assessment for treatment efficacy, patient outcomes, and potential audits strongly favor more advanced techniques. Considering the certified wound specialist (CWS) scope of practice, which emphasizes evidence-based care and meticulous documentation, which wound measurement approach best aligns with these principles for comprehensive wound assessment and progress tracking? Option A, manual tracing of the wound perimeter on paper. Option B, estimating wound volume based on linear measurements. Option C, digital imaging with calibrated software. Option D, ruler measurements of length and width only. The correct answer is C, digital imaging with calibrated software. Explanation: this scenario is professionally challenging because accurately measuring wound dimensions is fundamental to effective wound management, directly impacting treatment efficacy, progress monitoring, and reimbursement. The challenge lies in selecting the most appropriate and reliable measurement technique given varying clinical contexts, patient conditions, and available resources, all while adhering to professional standards and potentially regulatory requirements for documentation. Careful judgment is required to ensure that the chosen method provides objective, reproducible data that supports clinical decision-making and meets documentation expectations. The correct approach involves utilizing digital imaging with calibrated software. This method offers the highest degree of objectivity and reproducibility, minimizing inter-observer variability. Digital imaging captures a precise representation of the wound, allowing for accurate measurement of surface area, depth, and even volume if 3D imaging is employed. This detailed and consistent data is crucial for tracking changes over time, evaluating the effectiveness of interventions, and providing clear, objective documentation that can be reviewed by other healthcare professionals or auditors. Regulatory frameworks, while not always explicitly dictating a specific measurement tool, emphasize accurate and objective patient assessment and documentation. Digital imaging aligns with the principle of providing the most reliable and verifiable data for patient care and record keeping. Using only a ruler for linear measurements, while a basic technique, is an incorrect approach as the sole method for comprehensive wound assessment. This method is prone to significant inter-observer variability and may not accurately represent irregular wound shapes or depths, leading to potentially misleading data about wound progression. Relying solely on tracing can also be subjective and may not capture the full extent of the wound, especially if the tracing is not meticulously performed or if the wound bed is uneven. Volumetric measurements, while providing detailed information, can be technically challenging to perform accurately and consistently without specialized training and equipment, potentially leading to inaccurate data if not executed correctly. In all these instances, the lack of objective standardization and potential for subjective interpretation can lead to documentation that is not sufficiently robust for clinical decision-making or regulatory scrutiny. Professionals should employ a decision-making framework that prioritizes accuracy, reproducibility, and objectivity in wound measurement. This involves considering the wound's complexity, the clinical question being asked, the available technology, and the need for consistent, verifiable data. When possible, digital imaging should be the preferred method for its inherent objectivity. If digital imaging is not feasible, a combination of techniques that enhance objectivity, such as standardized protocols for ruler measurements or careful tracing with clear landmarks, should be employed. The ultimate goal is to obtain data that is reliable, reproducible, and defensible for clinical and administrative purposes. Question 15. The efficiency study reveals that a certified wound specialist, CWS, is evaluating a pressure injury. The wound bed exhibits a significant amount of yellow, stringy, non-adherent material covering approximately 60% of the surface, with the remaining 40% appearing as red, beefy granulation tissue. There is moderate serous exudate present. Which of the following wound bed characteristic assessments best informs the immediate treatment plan? Option A. The wound bed has a lot of yellow stuff and some red tissue with wetness. Option B. The wound bed is characterized by 60% slough and 40% granulation tissue with moderate serous exudate. Option C. The wound bed is mostly covered in non-viable tissue with some healthy tissue present and moderate drainage. Option D. The wound bed is healing well with good granulation and minimal drainage. The correct answer is B. The wound bed is characterized by 60% slough and 40% granulation tissue, with moderate serous exudate. Explanation. This scenario is professionally challenging because accurately assessing wound bed characteristics, particularly the percentage of different tissue types and the presence and nature of exudate, is fundamental to effective wound management and directly impacts treatment decisions. Misinterpretation can lead to inappropriate interventions, delayed healing, increased risk of infection, and ultimately, poorer patient outcomes. The Certified Wound Specialist, CWS, certification implies a commitment to evidence-based practice and adherence to professional standards of care, which are implicitly guided by regulatory frameworks that prioritize patient safety and quality of care. While specific CWS regulations are not provided, the general principles of healthcare practice in the U.S., which this exam likely aligns with, emphasize accurate assessment, appropriate documentation, and evidence-based treatment planning. The correct approach involves a systematic and objective evaluation of the wound bed, categorizing tissue types, viable granulation, slough, eschar, and estimating their percentages, alongside a thorough assessment of exudate, amount, color, odor, viscosity. This aligns with the core competencies expected of a CWS, ensuring that treatment strategies are tailored to the specific needs of the wound. This approach is ethically and professionally sound as it prioritizes accurate diagnosis and evidence-based treatment, which are cornerstones of patient care and professional responsibility. Adherence to established wound assessment protocols, often found in clinical practice guidelines and professional organization standards, underpins this approach. An incorrect approach would be to make a subjective or generalized assessment without detailed observation. For instance, simply noting some dead tissue without quantifying it or describing its nature, slough vs eschar, is insufficient. Similarly, a vague description of exudate like wet fails to capture crucial information about the wound status. Such approaches are professionally unacceptable because they lack the specificity required for effective treatment planning and monitoring. They can lead to the selection of inappropriate dressings, debridement strategies, or antimicrobial therapies, potentially causing harm or hindering healing. This deviates from the professional obligation to provide individualized and evidence-based care. The professional decision-making process for similar situations should involve a structured approach to wound assessment. This includes 1. Visual inspection under adequate lighting, noting the wound dimensions, depth, and surrounding skin. 2. Detailed characterization of the wound bed, identifying and quantifying viable and non-viable tissues. 3. Comprehensive evaluation of exudate, considering its quantity, quality, and any associated odor. 4. Correlation of these findings with the patient's overall health status and comorbidities. 5. Selection of interventions based on this comprehensive assessment and current best practices, with clear documentation of all findings and rationale for treatment. Question 16. The efficiency study reveals that a wound care clinic is experiencing prolonged healing times and suboptimal outcomes for patients with complex wounds involving multiple tissue types. The clinic's current protocol involves a standardized approach to debridement and dressing selection, regardless of whether the wound bed primarily exhibits exposed bone, compromised muscle, or damaged tendon. As a certified wound specialist, what is the most appropriate course of action to improve patient outcomes and align with best practices in wound management? Option A. Introduce a new line of advanced dressings that claim broad-spectrum efficacy for all wound types, without conducting a thorough review of their specific indications for bone, tendon, or nerve healing. Option B. focus solely on aggressive sharp debridement of all necrotic tissue, believing that complete removal of non-viable material is the primary driver for healing in any tissue. Option C. Increase the frequency of basic saline moistened gauze changes for all complex wounds to ensure consistent moisture balance, assuming this will accelerate healing across all tissue types. Option D. Implement a tiered treatment protocol that stratifies wound management strategies based on the predominant tissue type exposed e.g., bone, muscle, tendon, nerve, and incorporates evidence-based interventions specific to each tissue's healing characteristics. Correct answer is D. Implement a tiered treatment protocol that stratifies wound management strategies based on the predominant tissue type exposed e.g., bone, muscle, tendon, nerve, and incorporates evidence-based interventions specific to each tissue's healing characteristics. Explanation. Scenario analysis. This scenario presents a professional challenge in wound management due to the complexity of healing across different tissue types. The efficiency study highlights a common issue: a generalized approach to wound care that fails to account for the unique biological and physiological characteristics of skin, muscle, bone, tendon, and nerve. This can lead to suboptimal outcomes, delayed healing, increased patient morbidity, and potential financial implications for healthcare systems. The challenge lies in tailoring interventions to the specific tissue involved, ensuring that the chosen treatment modalities are evidence-based and align with the principles of wound healing for each tissue type, while also adhering to professional standards and regulatory guidelines for certified wound specialists. Correct approach analysis. The correct approach involves a comprehensive assessment of the wound bed, identifying the predominant tissue type involved, and then selecting a treatment strategy specifically designed to promote healing in that tissue. For example, a wound involving exposed bone requires a different management plan than a superficial skin abrasion. This approach is justified by the fundamental principles of wound healing, which dictate that different tissues have varying vascularity, cellular components, and regenerative capacities. Adherence to evidence-based practice, as mandated by professional organizations and regulatory bodies governing wound care specialists, requires this individualized and tissue-specific approach. This ensures that interventions are not only effective but also ethically sound, prioritizing patient well-being and optimal functional recovery. Incorrect approach is analysis. An approach that focuses solely on debridement and basic dressing application without considering the underlying tissue type is ethically and professionally flawed. This generalized method fails to address the specific needs of tissues like bone or tendon, which have limited vascular supply and different healing mechanisms compared to skin. Such an approach can lead to persistent infection, non-union, or functional impairment, violating the professional duty of care. Another incorrect approach would be to apply advanced therapies without a clear understanding of their efficacy for the specific tissue involved. For instance, using a hyperbaric oxygen therapy protocol designed for soft tissue regeneration on a wound with exposed bone, without considering the specific indications and contraindications for osteomyelitis or bone healing, would be inappropriate and potentially harmful. This demonstrates a lack of critical appraisal of treatment options and a failure to adhere to evidence-based guidelines for tissue-specific wound management. A third incorrect approach involves prioritizing speed of healing over the quality of healing and functional outcome. This might manifest as aggressive debridement that unnecessarily damages healthy tissue, or the premature closure of a wound that has not achieved adequate granulation or epithelialization for the involved tissue. This approach neglects the long-term implications for the patient's mobility and quality of life, and it fails to meet the professional standard of care that emphasizes comprehensive and restorative healing. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough wound assessment. This includes identifying the depth of the wound, the presence of exposed structures, and the overall condition of the surrounding tissues. Following this, they must consult current evidence-based guidelines and literature specific to the healing of skin, muscle, bone, tendon, and nerve. This informs the selection of appropriate debridement techniques, antimicrobial strategies, nutritional support, and advanced therapies, all tailored to the predominant tissue type. Regular reassessment and adjustment of the treatment plan based on the wound's response are crucial. This iterative process ensures that care remains aligned with the patient's evolving needs and the biological realities of tissue regeneration, upholding both ethical obligations and professional competencies. Question 17. What factors determine the most accurate and clinically relevant method for documenting a wound's anatomical location, dimensions, length, width, depth, and wound bed description for patient being managed under U.S. regulatory frameworks and professional wound care standards? Option A. Relying on the patient's subjective report of pain and general appearance of the wound, with measurements taken only when significant changes are perceived. Option B. Focusing primarily on the overall size of the wound without specific attention to anatomical position or detailed wound bed composition, assuming other team members will infer necessary details. Option C. Employing descriptive terms that are easily understood by laypersons, with measurements recorded only as approximations to avoid overwhelming the patient. Option D. Utilizing precise anatomical landmarks, standardized measurement techniques, and objective descriptions of wound bed characteristics, consistent with established professional guidelines and regulatory requirements for medical record keeping. The correct answer is D. Utilizing precise anatomical landmarks, standardized measurement techniques, and objective descriptions of wound bed characteristics, consistent with established professional guidelines and regulatory requirements for medical record keeping. Explanation: this scenario is professionally challenging because accurate and consistent documentation of wound location, dimensions, and bed description is fundamental to effective wound management, patient care continuity, and legal defensibility. Inaccurate or incomplete documentation can lead to miscommunication among healthcare providers, suboptimal treatment plans, delayed healing, and potential adverse patient outcomes. The Certified Wound Specialist (CWS) certification implies a commitment to adhering to the highest professional standards, which are often guided by regulatory frameworks and best practice guidelines. The correct approach involves a systematic and precise method for documenting wound characteristics. This includes clearly identifying anatomical landmarks to pinpoint the wound's exact location, using standardized methods for measuring length, width, and depth to ensure consistency and track changes over time, and providing a detailed, objective description of the wound bed, including tissue types, exudate, and any signs of infection. This meticulous approach aligns with the ethical obligation to provide competent care and the regulatory requirement for accurate medical records, which are essential for billing, quality assurance, and legal purposes. Adherence to established guidelines, such as those promoted by wound care professional organizations, ensures that documentation is comprehensive and interpretable by other healthcare professionals. An approach that relies on vague or subjective descriptions of wound location, such as on the leg, fails to provide the necessary specificity for accurate assessment and treatment. This lack of precision hinders continuity of care and can lead to errors in subsequent evaluations. Similarly, inconsistent or absent measurement of wound dimensions prevents objective tracking of healing progress, making it difficult to evaluate the effectiveness of interventions and potentially leading to prolonged or inappropriate treatment. Describing the wound bed with ambiguous terms like looks bad or some redness omits crucial clinical information regarding tissue viability, presence of slough or eschar, and exudate characteristics, which are vital for guiding treatment decisions and identifying potential complications. These imprecise methods represent a failure to meet professional documentation standards and can have significant ethical and legal ramifications. Professionals should employ a decision-making framework that prioritizes accuracy, objectivity, and standardization in wound assessment and documentation. This involves understanding and applying established anatomical terminology, utilizing consistent measurement techniques, e.g., clock face method for depth, longest dimension for length, and employing a standardized vocabulary for describing wound bed characteristics, e.g., granulation tissue, slough, eschar, necrotic tissue, exudate type and amount. Regular review of institutional policies and professional guidelines for wound documentation is crucial to maintain best practices. Question 18. Examination of the data shows a patient presenting with a deep, jagged laceration to the lower extremity sustained from a fall onto sharp debris. The wound is actively bleeding, and the patient reports significant pain. The surrounding skin appears pale and cool to the touch. What is the most appropriate initial approach to managing this traumatic wound? Option A. Cleanse the wound superficially with saline and apply a hydrocolloid dressing to maintain a moist environment. Option B. Proceed directly with aggressive debridement of all devitalized tissue to promote healing. Option C. Immediately apply a pressure dressing and administer analgesia, followed by a thorough wound assessment including evaluation of distal pulses and sensation. Option D. Administer broad-spectrum antibiotics and cover the wound with a sterile gauze pad. The correct answer is C. Immediately apply a pressure dressing and administer analgesia, followed by a thorough wound assessment including evaluation of distal pulses and sensation. Explanation. This scenario presents a professional challenge due to the immediate and potentially severe nature of a traumatic wound, requiring rapid and accurate assessment to prevent complications and ensure appropriate intervention. The Certified Wound Specialist, CWS, must balance the urgency of the situation with the need for a thorough, evidence-based approach, adhering to professional standards of care and ethical obligations. The correct approach involves a systematic assessment that prioritizes patient safety and identifies all contributing factors to the wound's etiology and current state. This includes a comprehensive history, physical examination focusing on the wound characteristics, e.g., depth, contamination, presence of foreign bodies, vascular status, neurological function, and consideration of the mechanism of injury. Management should then be guided by this assessment, employing appropriate debridement, cleansing, dressing selection, and pain management, with a clear plan for ongoing monitoring and evaluation. This aligns with the CWS certification's emphasis on evidence-based practice and the ethical imperative to provide competent, patient-centered care as outlined by professional wound care organizations and general healthcare practice guidelines that emphasize thorough assessment prior to intervention. An incorrect approach would be to proceed with treatment without a complete assessment. For example, initiating aggressive debridement without first assessing for underlying structural damage or vascular compromise could lead to iatrogenic harm. Similarly, applying a dressing without adequately cleansing the wound or considering the presence of contamination would fail to address the etiology and could promote infection. Another incorrect approach would be to solely focus on the visible wound surface while neglecting the broader patient context, such as underlying comorbidities or the mechanism of injury, which are crucial for understanding the wound's trajectory and developing an effective long-term management plan. These failures represent a deviation from best practices and could be considered professional negligence, violating the ethical duty to act in the patient's best interest and the professional standard of care. Professionals should employ a decision-making framework that begins with a rapid, yet comprehensive, assessment of the patient and the wound. This involves gathering subjective data, patient report, and objective data, physical findings, followed by analysis to formulate a differential diagnosis for the wound's etiology and potential complications. Based on this analysis, a treatment plan is developed, implemented, and continuously evaluated for efficacy, with adjustments made as needed. This iterative process ensures that care remains aligned with the patient's evolving needs and the best available evidence. Question 19. When evaluating a chronic non-healing wound exhibiting significant exudate and a pale, avascular wound bed, which of the following cellular profiles best explains the impediment to healing, considering the typical stages of wound repair? Option A. Abundant platelets forming a stable clot, with moderate fibroblast activity and robust keratinocyte proliferation at the wound edges. Option B. Predominance of neutrophils and macrophages actively clearing debris, with early fibroblast infiltration and nascent keratinocyte migration. Option C. A high density of mature fibroblasts producing abundant collagen, with minimal inflammatory cell presence and complete epithelialization. Option D. A sustained high concentration of neutrophils, limited macrophage activity, and a significant deficit in fibroblast proliferation and collagen deposition, alongside impaired keratinocyte migration. The correct answer is B. A predominance of neutrophils and macrophages actively clearing debris, with early fibroblast infiltration and nascent keratinocyte migration. Explanation. This scenario presents a professional challenge because it requires the Certified Wound Specialist, CWS, to interpret complex cellular interactions in the context of a non-healing wound, necessitating a deep understanding of the underlying biological processes and their clinical implications. The difficulty lies in distinguishing between normal physiological processes and pathological deviations that impede healing, demanding precise application of knowledge regarding cell types and their functions. Careful judgment is required to avoid misinterpreting cellular activity, which could lead to inappropriate treatment strategies and further compromise patient outcomes. The correct approach involves accurately identifying the predominant cellular players and their roles in the wound microenvironment, specifically recognizing the interplay between inflammatory cells, fibroblasts, and keratinocytes. This approach is right because it directly addresses the core of the question by linking observed cellular activity to the stages of wound healing. For instance, understanding that macrophages are crucial for debris clearance and growth factor release, while fibroblasts are responsible for collagen synthesis, allows for a comprehensive assessment of the healing trajectory. This aligns with the CWS scope of practice, which emphasizes evidence-based wound management informed by a thorough understanding of wound pathophysiology. The ethical imperative is to provide the most effective care, which stems from accurate diagnosis and understanding of biological mechanisms. An approach that focuses solely on the presence of neutrophils without considering their stage-specific role or the presence of other critical cell types is incorrect. Neutrophils are essential in the initial inflammatory phase, but their prolonged presence without resolution indicates a problem, not necessarily the sole cause of non-healing. This approach fails to provide a holistic view of the cellular dynamics and could lead to misdirected intervention, such as solely focusing on antimicrobial therapy without addressing underlying issues like impaired fibroblast function or keratinocyte migration. Another incorrect approach is to overemphasize the role of platelets in isolation. While platelets are vital for hemostasis and releasing initial growth factors, their function is transient. Focusing exclusively on platelets ignores the subsequent, more sustained cellular processes required for tissue repair, such as granulation tissue formation and epithelialization. This limited perspective fails to account for the complex, multi-stage cellular cascade necessary for wound closure. An approach that attributes non-healing solely to a lack of keratinocyte proliferation without considering the supporting cellular environment is also flawed. Keratinocyte migration and proliferation are dependent on a healthy extracellular matrix, adequate vascularization, and appropriate signaling from inflammatory cells and fibroblasts. Neglecting these interdependent relationships provides an incomplete picture and can lead to ineffective treatment plans that do not address the root cause of impaired epithelialization. The professional decision-making process for similar situations should involve a systematic evaluation of the wound bed, considering the cellular milieu in conjunction with clinical factors. This includes assessing the stage of healing, identifying any signs of infection or inflammation, and understanding the patient's overall health status. The CWS should then correlate these observations with their knowledge of cellular biology to formulate a targeted and evidence-based treatment plan that addresses the specific cellular deficits or excesses contributing to the non-healing wound. This iterative process of assessment, interpretation, and intervention, grounded in scientific principles, is paramount for optimal patient care. Question 20. The performance metrics show a chronic lower extremity wound that has been present for 6 months, with recent documentation indicating delayed healing and the development of a raised erythematous scar. The patient expresses significant concern about the scar's appearance and discomfort. The wound care team is considering several approaches to manage this complex presentation. Which of the following represents the most appropriate and ethically sound course of action for a certified wound specialist? Option A. Focus solely on achieving wound closure with standard dressings, advising the patient that scar formation is an expected outcome of chronic wounds and not a primary concern for wound management. Option B. Conduct a comprehensive reassessment of the wound and the patient, including a review of systemic factors, nutritional status, and potential for infection, and consult with the interdisciplinary team to develop a holistic, evidence-based treatment plan that addresses both delayed healing and scar management. Option C. Initiate aggressive sharp debridement of the entire wound bed to promote new tissue growth and apply a silicone-based dressing to manage the scar. Option D. Increase the frequency of dressing changes to daily and apply a topical antibiotic ointment to the scar area to reduce inflammation. The correct answer is C. Initiate aggressive sharp debridement of the entire wound bed to promote new tissue growth and apply a silicone-based dressing to manage the scar. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it involves a patient with a complex chronic wound exhibiting signs of delayed healing and potential hypertrophic scarring. The challenge lies in accurately assessing the multifactorial nature of the delayed healing, differentiating between normal healing variations and pathological processes, and implementing an evidence-based, patient-centered treatment plan that aligns with the Certified Wound Specialist (CWS) scope of practice and relevant U.S. regulatory frameworks. Failure to do so could lead to suboptimal patient outcomes, increased healthcare costs, and potential professional repercussions. Correct approach analysis. The correct approach involves a comprehensive reassessment of the wound, including a detailed history, physical examination, and consideration of systemic factors. This aligns with the CWS scope of practice, which mandates thorough patient assessment and the development of individualized care plans. Specifically, the CWS is expected to identify and address factors contributing to delayed healing, such as infection, inadequate nutrition, underlying comorbidities e.g., diabetes, vascular insufficiency, and inappropriate dressing selection. The approach of consulting with the interdisciplinary team, including the patient's primary care physician and potentially a dietitian or physical therapist, is crucial for a holistic management strategy. This collaborative approach is supported by ethical principles of patient care and is often implicitly or explicitly encouraged by healthcare regulations that emphasize coordinated care and patient safety. The focus on evidence-based practice and patient education is also paramount, ensuring that interventions are current and that the patient understands their role in the healing process. Incorrect approaches analysis. An approach that solely focuses on aggressive debridement without a thorough reassessment of contributing factors to delayed healing is professionally unacceptable. While debridement is a vital component of wound management, its indiscriminate application without understanding the root cause of delayed healing can exacerbate tissue damage, increase pain, and fail to address underlying issues like infection or poor perfusion. This could be considered a deviation from best practices and potentially a violation of professional standards of care, which require a systematic and evidence-based approach. Another incorrect approach would be to dismiss the patient's concerns about scarring and focus only on wound closure. Hypertrophic scars and keloids can significantly impact a patient's quality of life, causing pain, itching, and functional limitations. Ignoring these aspects of wound healing, especially when they are a prominent concern for the patient, represents a failure to provide comprehensive care and uphold patient-centered principles. Ethical guidelines and professional standards emphasize addressing the patient's holistic needs, not just the physical wound itself. Finally, an approach that relies on anecdotal evidence or outdated treatment modalities without consulting current literature or interdisciplinary colleagues is also professionally unsound. The CWS credential signifies a commitment to advanced knowledge and skills, which includes staying abreast of the latest evidence-based practices. Relying on outdated methods can lead to ineffective treatment, prolonged healing times, and potential harm to the patient, which could have regulatory implications if patient safety is compromised. Professional reasoning. Professionals should approach such scenarios by first prioritizing a thorough, systematic assessment to identify all contributing factors to the patient's delayed healing and scar formation. This assessment should guide the development of an individualized, evidence-based treatment plan. Collaboration with the interdisciplinary team and ongoing patient education are essential components of this process. Professionals must continuously evaluate the effectiveness of interventions and adapt the plan as needed, always adhering to the highest ethical standards and regulatory requirements for patient care.